Hello, I'm Dr. Laura Murillo. Thank you for joining us. Our guest today is Veronica Sanchez. She's been involved with the Houston Hispanic Chamber of Commerce for many, many years, very active in the community, and certainly is a pillar as it relates to the work that she's done with the American Heart Association. As you can see, she's wearing red, which is certainly something that we're going to talk about. But let's welcome Veronica. Thank you so much for being with us.
Thank you so much for the invitation. Always a pleasure.
Absolutely. So tell us what's new at the American Heart Association.
Well, this year is a very special year for the American Heart Association. We are having our centennial, which means that we are turning 100 years old. Along with our volunteers and supporters and collaborating organizations, who has worked to build longer, healthier lives. The AHA was founded back on June 10th, 1924. Heart disease at that time was considered a death sentence, unfortunately. The best option that many people were given at the time was just to have bed rest. There was no treatment, there was no hope. But every person deserves the opportunity to live a full, healthy life. So, as champions for health equity, the American Heart Association continues to advance cardiovascular health for everyone, including identifying and removing barriers to healthcare access and quality. Through our scientific research and the power of millions of volunteers and supporters, we have a deep understanding of the many factors that contribute to heart disease, from traditional medical issues such as high blood pressure to societal problems, to structural racism and discrimination. Here's how we've made a difference and impacted the community. We've had a 13.6% reduction in deaths from strokes. Over $5 billion plus has been invested in research since 1949, more than any U.S. organization except for the federal government. A 15.1% reduction in deaths from heart disease, 12 million reached by nutrition improvements in 44 communities, and 19 million plus patients benefiting from our quality care initiatives for high blood pressure, and over 22 million people have been trained in CPR. So as you can see, in our first century, we have done quite a bit of work, but
Yes.
we are also looking forward to our second century and moving the needle and continuing to improve health for everyone.
And a lot of it is, as you mentioned, the educational component, which is exciting because we know that we're having conversations today with you about Walking Day, about Hispanic Month, and so many other initiatives.
That is correct. The Hispanic population has heavily been impacted by cardiovascular disease and stroke, but this is what the American Heart Association is doing about it. A lot of times people don't even realize that every 34 seconds, someone in the United States dies from cardiovascular disease, and every 3 minutes and 14 seconds, someone dies from a stroke. Nearly half of all U.S. adults have high blood pressure, and they don't even know it. But if you're Hispanic, guess what? Instead of every 34 seconds, it's every 13 seconds.
Oh,
Every 13 seconds, Laura, one of our people is dying. And so there's things that we need to do. And so here in Houston, I just wanted to share some statistics right here in our own backyard. 45% of Hispanic males and females are overweight and obese. 50% of Hispanic males and over 35% of women are hypertensive or have high blood pressure. 51% of males and 41% of females are pre-diabetic. And 52% of males and 38% of Hispanic females have a prevalence of cardiovascular disease. In Houston, the American Heart Association really wants to be a part of the solution. We've been impacting 1.8 million Houstonians through our quality improvement programs, through our local relationship with over 288 support organizations that range from hospitals to clinical systems, which is then reducing the number of deaths and disability as it relates to cardiovascular disease and stroke in the greater Houston area. The next time you go to the doctor and get your annual physical, ask and follow up with these questions. What are my numbers? What are those? What is my blood pressure? What is my cholesterol? What is my blood glucose and BMI? But more importantly, at home, we need to also monitor our weight and our waist circumference, because those are all predictors of having potentially, if they're high, having a prevalence or a higher risk of having a heart attack or a stroke. And so those are just some things that I would recommend to your viewers that they do, going forward.
well, all very important advice. And as you mentioned, so much of it can be prevented or managed and maintained. So we ask everyone to visit their doctor, make sure you know your numbers, as was said here earlier by Veronica. And lastly, uh, if there's things that you can do, like walking, simply losing some weight, all of those things can help increase your chances of survival and a less likelihood of heart disease. Veronica, anything else you'd like to add?
I just want to say, April 3rd is coming up, and that's National Walking Day. So I would say exchange your working shoes for your sneakers, take a walking meeting, have do a conference call walking, but just do anything you can to stay physically active on that day and every day as well.
Every day. Thank you so much, and we look forward to seeing you very soon. Bye bye.
Thank you.